COVID-19 cases are surging across China right now. Until very recently, it had some of the toughest control measures in the world. Public anger and rare street protests led to many rules being relaxed. Experts are now warning hundreds of millions of people could soon be infected, and Chinese authorities have further narrowed the criteria for identifying COVID deaths. This means that despite the jump in cases and overwhelmed funeral homes, there have been no official recorded deaths for 2 consecutive days.
At times, China's zero-COVID policy looked like this. Empty streets in some of the world's largest cities like Shanghai. Here, 28 million people are nowhere to be seen. Other times it looked like this, with aggressive scenes in supermarkets and people desperate to grab some of the sparse food and supplies still available. There were also containment camps, entire city blocks and neighborhoods locked up, and barriers built to prevent free movement. China's zero-COVID rules were some of the most strictly imposed anywhere. Residents were repeatedly told zero-COVID was the only way to keep them safe.
We must unswervingly adhere to the principle of people first and life first, the strategy of curbing imported cases and domestic resurgences, and the policy of dynamic zero-COVID.
But then this fall, cases began to spread rapidly, despite the strict policies. Many Chinese experienced for the first time someone close to them getting sick with COVID. And as cases spiraled, so did public discontent. In late November, a rare showing of public dissent erupted in multiple parts of China. There were street demonstrations, and even some called for President Xi Jinping to resign. The kind of public outcry unheard of inside China. Then 2 weeks later, a change of heart from the government. The health department announced the loosening of 10 zero-COVID rules.
Our focus will be increasingly science-based and targeted. We should firmly correct oversimplification or a one-size-fits-all approach and avoid taking excessive policy steps.
On December 7th, China loosened measures, allowing home quarantine, reduced testing, and making it easier to travel. Chinese authorities and state media largely ignored the protests and accusations that zero-COVID failed. Instead, they've been insisting the relaxed policies are due to a weakened coronavirus. But weakened or not, the infections have been spreading rapidly, creating fear and anxiety and further disrupting an already fragile economy. Experts warn China could soon be facing a peak of up to 800 million cases in the country, which they say could mean as many as 1 to 2 million deaths in the coming year.
Let's cross straight over to our correspondent Fabian Kretschmer in Beijing. Fabian, we're hearing reports of Chinese hospitals struggling and crematoriums being overwhelmed. How serious is the situation there?
Yeah, the first big nationwide Omicron wave here in China has clearly overwhelmed the health system of the big cities. Here in Beijing, we've seen that doctors had to go to work despite being infected because, you know, the virus was so widespread. I would estimate in the inner city districts here in Beijing, probably up to 80% of the population has been infected in the last 2 weeks. So there were, of course, also long queues in front of funeral homes and the crematoria working at overtime. So, I mean, it was really an extreme stress test, but it seems that the worst in Beijing is already over. Now the number of recovered people is also increasing and bringing back life to the city, for example, with crowded restaurants and, you know, traffic picking up. But in many other parts, the infection rise is just starting. And I think the biggest stress test will happen in the provinces, namely those provinces where the health system is not as developed as it is here in the big cities.
After acting for months on the assumption that the virus could be stopped entirely, has the government, Fabian, come to terms with the actual scale of the crisis it's facing?
Well, I mean, the government basically decided to change the criteria how it counts COVID deaths just when really the wave was exploding here. So now it is very strict what actually constitutes death by COVID. And that leads to very absurd official data. For example, today, officially, there were only 3,000 symptomatic COVID infections and 0 new deaths. Of course, this is not plausible, and this is basically to whitewash the pandemic situation. In my opinion, this is quite irresponsible because it leads to the assumption that the virus is less dangerous than it actually is, because of course people are dying, but most of them do not show up in the official statistics. And that makes it also very difficult to really holistically assess the situation in the whole country.
Now, China is using its domestically produced vaccines to fight the pandemic. Do experts there, Fabian, believe that will be sufficient?
Well, I mean, the gold standard of vaccines are mRNA vaccines, and namely, Western vaccines. They are more efficient than the Chinese ones, but I mean, the Chinese vaccines, they are also efficient, but it is crucial that you need to have at least 3 doses, 3 shots of the vaccines to be efficient against Omicron. And I think the biggest obstacle is not whether they use domestic or foreign vaccines, but mainly whether the elderly, the vulnerable people here want to get vaccinated. There was a lot of hesitancy, and also there was one big mistake that the government did since last year. It put all the medical resources into quarantines and all the lockdown measures, and that has slowed down the national vaccination program really quite a bit. So what they do now is, of course, remarkable. There's a lot of speed how they want to vaccinate the people, but of course it's too late and too little. This is not a battle that can be won. This is only damage control.
Fabian, thank you very much. That was Fabian Kretschmer there in Beijing.